Hello everyone, this is Atif Sheikh from South Asian Disability Forum. I'm based in Pakistan. Thank you very much for joining us on this important discussion. Almost all the participants have joined by now, and I think we are very much on time to start it. Before starting the meeting, may I request all of you to mute your microphones when you are not speaking. So it will be an uninterrupted discussion which everybody can hear. Secondly, this meeting is coming online live on the Facebook. So people around the world who are not even joining us, they will be listening, watching the conference live at the home. So I would request again to keep your microphones on the mute when you are not speaking. And
Cannot
whenever
hear. Cannot hear.
I speak. Okay. So, can you hear me now? Hello? Hello? Can you hear me now?
Yes, now it's better.
Okay, good. Thank you. Thank you. So I was saying that this conferences will be live on the Facebook, and most of the people who are not even joining, they will be watching. So, and even during the discussion, it would be very helpful if we keep our microphones on the mute so that discussion will be uninterrupted. And the format of the discussion, like we will start as per agenda. We will request all the people to speak 2 to 3 minutes, including their introduction, their initiatives, and the challenges they are faced in their respective countries. In the last slide, we will have speaker from UNDRR, Mr. Timothy Wilcox. He will be giving us a perspective of what United Nations and as a UNDRR, what they are contributing and how they are addressing this issue. We have also joined by Ms. Marcy Roth, the chairperson of World Institute on Disability. She will give us a global perspective. And at the conclusion, she was not included in the agenda till this morning, but we are very much grateful to UNESCAP. Ms. Aiko Akiyama will be concluding this meeting at the last finally at the end of this meeting. So before starting, let me give you an overview that in South Asia, which is the most thickly populated region in the world, having a person with disabilities almost according to the World Report in the 15% of the percentage, and almost same conditions in these countries that people with disabilities are going through. The major barriers which have been assessed or so far been discussed at the national meetings are their rehabilitation services have been stopped. They are losing their sources of income and they were socially disconnected, but now they are facing double kind of disconnection or discrimination during this COVID response. The major issue which has not been addressed so far, that people with disabilities in developing countries are not being tested for the coronavirus, for the COVID-19. They are not being tested at all because they don't have access to the hospitals or the testing facilities. Or there are some other issues which will be discussed in this meeting by other participants, so I will leave on them. As a first speaker, I would request Ms. Shruti Mahapatra from the National Center of Employment of Disabled People in India. She is also representing Commonwealth Forum of Persons with Disabilities in India. So I would request Shruti, if you can give us the overview of disability after this pandemic in South Asia and what Indian DPO especially and civil society and the government is there, what kind of steps they are taking to address it. Shruti.
Thank you, Atif. Actually, I represent Swabhiman, that's the non-profit in Eastern India. And I represent National Disability Network, which is actually floated by NCPDP. Now, and also CDPF, which Atif just mentioned. Now, before straight away giving you an overview of the situation, I thought it will be important for us to know a few things very important in South Asia. And why is COVID 19 such a huge concern for people with disabilities in the South Asian region? The number one is it is one of the most populous region, and the entire population of SARC region comprises 21% of the world population. Until then, if you look at the number of cases, till 3rd of May, it is 75,970 cases and a total of 2,092 deaths. The second reason of concern is it is one of the least developed world regions. The third is it is highly vulnerable to any large scale outbreak of an infectious disease because of three things. Number one, we have very poor health infrastructure. The ratio of doctors per capita is one of the lowest. In India, it is one doctor for 1,000 people. And I could get the statistics of Bangladesh and Pakistan, which is 0.389 per 1,000 in Bangladesh, and Pakistan 0.806 per 1,000. And when you look at these two figures, these three figures, the number of doctors to number of people, it is pretty frightening, because within that we have to compete for our space among those who don't have a disability. However, some of the good things where in the Indian DPOs we have been doing a lot of advocacy and getting into is the SARC countries have come together to create a SARC COVID-19 emergency fund, and till April 11th, the total contribution is about 21.8 million, to which I think there is a scope for advocacy here. And second is in SARC region, there has been the SARC Disaster Management Center has launched a website for getting all kinds of information in all the countries in this region. And we have Bangladesh, India, Maldives, Nepal, Pakistan, and Sri Lanka. These have dedicated COVID-19 portals. So these are some positive things, good things that are happening. Now, coming to India and what we are doing in India, India is a huge country. The number of people with disabilities is, if we go by all the three numbers, if we go by the world report which came out, the percentage is 15%, and then if we go by the new law which came in 2016, the number of disabilities increased from 7 to 21. So we are a huge chunk of population, but lot of people with disabilities here in India are facing some major challenges. And one challenge has been the access to food. Access to food has been a big problem because many people with disabilities, this pandemic has brought into fore many of the things, like many do not have proper documentation. Now this time government made it essential, made it mandatory that those who have their bank accounts, those who have the required documentation, immediately the disability pension of 3 months will be deposited in their account. But many people with intellectual disabilities, people living in many of the institutions, people living at home with parents who are not educated, who are in the labor class, many of them lack documentation. So the initial stage access to food is a huge problem. Second is access related to healthcare facilities and availability of medicines. See, these are some crucial things which came to fore. Number one, people with the three blood disabilities, hemophilia, sickle cell anemia, thalassemia, they had a major problem in accessing the blood bank, getting blood in time, and this created a lot of furor, right? And I think there is a lot of deliberations going on as to how are we going to address it. Then government put a check on the availability of medicine for people who have mental illnesses, depression. So that mental illness, that category of people with disabilities faced again a huge lot of problems. Now you see, if we go to rural India, then we will find that most of the people who are high level, who have a higher level of, Atif, please tell me when to stop, then I'll quickly wind up.
Yeah.
So lot of people who are high support need persons in the rural areas, they have family members as the caregivers. But as you move to the metros and you move to the cities, dense towns and all, which have become very commercially very active and business centers, most people with disabilities, they are dependent on professional caregivers whom you pay monthly. So when the lockdown was put into place, there were many who were stranded. I'm telling you my example. There was a nurse who was coming every day to take care of me, and she stopped coming. She could not come in the initial phases. Passes were not this thing, so I had to manage with a few people who were there at home. But think about those who are staying alone, who were staying independently. That was a major healthcare, the caregiving issue which people suffered from. Then livelihoods. One of our greatest challenges of us people with disabilities is, if you take the livelihood, if you segregate the various categories of employment people are in, you'll find out most people are in the informal categories. So being in this informal categories, they don't have lot of safety nets. They don't have a provident fund, they don't have a regular saving. So this category of people who are maximum in the disability sector, they were also very harshly impacted. Even now, we have been here in Odisha itself, we have been providing dry ration to hundreds of people who are either daily wage laborers, or they are driving small rickshaws or auto rickshaws. Then access to information and helpline was a huge problem, because most of the websites, they're not accessible, they're not disabled friendly. So a huge chunk of people could not access information about hand washing and about what steps government is taking, from where they can get their relief ration. So these are some of the, and during the course of discussion, I will also keep on adding, but I will finish here so that the others can
Thank you.
contribute.
Yeah, thank you. Yeah, Shweti, thank you very much for giving a comprehensive picture of the South Asian situation. Now I would request Pema from Bhutan, Pema Shugal. Pema is also a member of the South Asian Disability Forum for a long time and contributing on DRR in different countries. Pema, can you give us an overview about Bhutan only? Pema, are you there? Pema, he's online, but if he's not ready, then
Can you hear me?
yeah, we can hear you, Pema. Go ahead.
Can you hear? Can you hear me?
Yes, we can hear you, Pema.
Okay.
Pema, we
Good
can hear
evening.
you.
Okay. Good evening, everybody, and nice to be on this meeting. It's very timely and very important. So in Bhutan, with the latest population census, we have about 2.1% of the Buddhist population is with disability in all ages. So now in Bhutan too, because of the COVID-19, the lives of the persons with disabilities are impacted quite significantly. And firstly, the employment, the children, the people with disabilities, their employment has been impacted because uh, especially those who are working in the private sectors and corporate sectors, because now private sectors, as they work mainly on the profit perspective. So when they do not have their business on going, so then they face difficulty in retaining their staff. So that's why our colleagues with disabilities who are engaged in some private business and private employment, they are impacted quite significantly. And next thing is the in education. Now because of the COVID-19, so the schools in Bhutan are all closed, but now the government has a plan to engage them at home. So government has initiated the broadcasting the lessons and adapted lessons to all students in Bhutan through TV. But now the problem with persons with disability is some persons with disabilities, they do not have TVs at home, and the teachers, they are also trying to connect through WeChat, WhatsApp, and also on Google Classroom, Messengers, and all. However, as our children, they do not have devices, they are not able to access to all this information. That is the most uh, teething problem that we have for our students right now. But now, are you able to hear me? Do you hear?
Yes.
Mr. Chairman, do you hear me?
Yeah, Prema, we can hear you very clearly.
Okay, so now
Prema,
the
yeah,
government
go
has
ahead.
initiated just now proposing proposals to supply some devices, at least our children with disabilities, they can keep connected with some learning, they can be at least engaged with learning. And
Okay.
still we are also developing our teachers in the schools, they are also developing the materials which are appropriate for them. For example, for children who are with deafness and hearing impaired, they are preparing some video clips based on their signs, based on their needs, and then sharing through the social media, for example, WhatsApp, messengers, and others. So for other uh, students with disabilities, their respective subject teachers, they are trying to reach the information and also following up with their parents. However,
You,
as
Prema, thank you very much.
have I completed my
Prema,
as
thank you very much. We can go to the, yeah. So, Prema, go ahead. We can.
okay, as some of the parts of the country are not they do not have they do not have proper network, so they are not able to contact. So this is what we have been facing. However, our government under the His Majesty's support, so that people now they are doing survey, and they are trying to collect information who else need most needs who support, and they are trying to sort out what sort of support they can give. So this is what it is happening. And in the education also, now we are trying to develop self instructional materials that we can post. And also next is the management of devices and this connectivity for these children. Now these are the especially the also people are um, keeping in contact with the parents and caregivers, how to support them at home, and also advising them, providing counseling so that they do not become the victim of abuses. And today, a group of special team, they also had the psychosocial first aid training. So I was one of them. So now um, the people with disabilities are also included in the psychosocial first aid training, and now they can access to this information, counseling and other services whenever they need. They have the hotlines, they have these contact numbers provided, and they can contact these people anytime they need. So we are also disseminating this information to persons with disabilities across. So we hope that this will help at least at a certain length to persons with disabilities in Bhutan. So I think this is what I can share for now. Thank you, Mr. Atif.
Thank you very much, Prema. Now I would request Mr. Ahmed Mohammed from Maldives. Ahmed, if you can share how Maldives is responding and what kind of responses coming from the DPOs on this situation. and what are the major challenges? Ahmed, are you there? Ahmed? Can you hear me?
Yeah, Assalamualaikum,
I think,
Atib bhai.
yeah. Salam.
Can
Yes,
you
go
hear me?
ahead.
Can you hear me?
Yes, Ahmed.
Yes,
My bandwidth is very low, the internet connection.
you are very clear.
So you can try. Could we call you later?
Yeah, please.
Okay, no problem. We can move to the next speaker. Abia Akram from National Forum of Women with Disabilities from Pakistan is here. She is going to join in 2 minutes, so we can request Ms. Pratima Goran, who is from the National Indigenous Disabled Women Association in Nepal and part of a large number of DRR discussion around the world. Pratima, good to see you in this meeting. Can you share about the situation in Nepal on this response, Pratima?
Thank you, Atif, and thank you to all the organizer for providing me this opportunity to share our experience as indigenous people and women with disabilities. I am Pratima Gurung, representing myself as an indigenous woman with disability from Nepal. And right now I represent the National Indigenous Disabled Women Association of Nepal. And also I belong to Indigenous Persons with Disabilities Global Network, and which again Atif has also mentioned about that I'm also equally connected with the DRR in Asia. So my experience will be not only focusing on Nepal, but it will be highlighting the work that we have done as indigenous people with disabilities in Asia. And in this, by saying this, I just wanted to connect to the recently report that we have submitted. The report was a two weeks lockdown situation of people with disabilities and marginalized group that was being submitted on 31st of April to the Special Rapporteur on Disability, Indigenous People, Minority People, Health, and Violence Against Women. So I would like to reflect on those reports also. As we say that indigenous people with disabilities are 54 million all around the globe, and 28 million are indigenous women with disabilities. And Asia has a huge population who has this group. So when it comes to the COVID pandemic situation, right now the whole world is affected. But when you see the vulnerable people who are already been affected in the normal conditions, like women, people with disabilities, indigenous people, daily wages, labor. So these are the people who are really very affected in this pandemic. So just to highlight about the indigenous people with disabilities, one of the challenges that we face, not only in Nepal, but also in whole Asia, is lack of information. So when it comes to lack of information, there was not sign language interpretation provided to the deaf people. But when it comes to groups like indigenous people with disabilities, for them the native mother tongue language is equally important, and those things were not kept into the priority. So lack of informations on equal basis with others was very much important for them. So when it comes to rural indigenous communities, they did not know about the word like quarantine, self-isolation, social distancing. So these technical words was really very difficult to them to make understand, because the government and the different agencies and the stakeholders did not have wider disability, gender, and cultural perspective of disseminating the information. So that was one of the challenge that a person with disabilities, including the marginalized groups, faced. The second thing was access to lack of sanitation, hygiene kits, medical apparatus, which already my colleague have already mentioned. But when it comes to indigenous people, their culture is not in a way that they are not familiar with washing hands all the time. So the cultural perspectives, coming from a cultural perspective and making them understand and realize, because they have been living in a community. So that was the challenge for us. So those things were not also not taken into account. And when it comes to the consultations and also preparations of providing disseminations around COVID, and also the support that is required for people with disabilities, including the marginalized groups. There was not a kind of close consultations and meaningful participations of person with disabilities and marginalized groups in any kind of structures, either either in the government structure or in the civil society structure. So there was a huge gap, and I'm sharing this information about the 2 weeks when the lockdown stay situation started. But later on, that situation was quite different, because there was a huge advocacy from people with disabilities and their organization, including other marginalized groups organizations. So now things have changed, but still there is a huge need of inclusive approach. This is what I just wanted to highlight. The fourth thing that I wanted to highlight was about the increasing rate of violence and discrimination. The cases of rape, violence inside the private sphere is still not able to come outside. We have been hearing some publicly report, which has been reported in different sphere, and those cases are coming day by day. So the increasing rates of discrimination and violence against women with disabilities and indigenous women with disabilities is rapidly increasing. And when it comes to indigenous people, we have been hearing prejudices, genocides, racism against indigenous people and minority group. The stigma is increasing day by day. If you see, I just want to bring an example of India. In Manipur state, we have been hearing and we have been discussing with our friends from there who are indigenous and who are from the minority groups. They have been disseminating those information to us that the genocide and racism is increasing day by day. As a result, these people are made more vulnerable and risk. The last thing that I wanted to highlight was about the minority groups. They are facing one of the challenges is right to live. And in right to live, the first thing is about the food, because since they do not have citizenship and the disability card, they're not able to get relief packages right now. So it has really been, right now we are in 40 days, around 40 days lockdown in Nepal, and these groups are not able to receive those relief packages. The first thing. The second thing is the psychosocial support for their well-being and for their health is very much required, and that has not been a dimension that the civil society organization, including the government, has not put focus. As a result, we have been seeing that the suicide rates are increasing day by day, and that has really brought a challenging and a very much a dilemma position, because due to the social distancing, even DPOs like us and activists like us, we are not able to go to the place where they are facing those challenges. And when it comes to indigenous and minority groups, accessible forms of all these things, internet, laptop, media, communication, all these things are really very vacuum to those groups. So the only way that we are able to communicate is with some few people from the marginalized community. So this has been a challenge. So we are not able to provide the psychosocial support that is really required for marginalized groups, including women with disabilities in this pandemic situation. So I will just stop here. And the last thing that I wanted to highlight is about there is no any kind of accessible cultural and disability system when it comes to hospital, the quarantine space, all those spaces which are built for safety measures for all people is not very much accessible for person with disabilities, including marginalized groups. Thank you.
Thank you, Pratima. For the next speakers, I have one question. Like listening to all these situations in different countries and having some meetings with the National Disaster of Management Authority, we are coming up with one question: that how many people with disabilities have been tested positive? You know, the data at the hospitals and testing centers, disabled people are not being counted. Like whether they are disabled people are coming or not, but the data is not disaggregated data is not available. So I would request other speakers when they will be speaking in their countries, they are recording the data of person with disability at the time of testing or not. Now I will request Abia Akram from National Forum of Women with Disabilities, Pakistan. Abia, over to you.
Abia, can you unmute your
Okay.
Hi, can you hear me? Thank you so much. Thank you for giving me the opportunity. I think this is really good to see you all, and I hope everyone is fine and safe and staying back at home. I know this is very critical situation for all of us, especially in the South Asia region, where we see the Disabled People Organization, the other civil society organizations, UN, international organization, all of them are working together just to bring a positive change in the lives of persons with disability. We have seen now some of the good examples also where persons with disabilities are getting opportunities to at least survive in this situation. But the challenges are much more and greater than the opportunities. So how we can collectively come up with some solutions, and we can see how we bring the change in the lives of persons with disability from the perspective of women and girls with disability. I just want to give an overview. Like in Pakistan, we have more than 20,000 people who have declared as a COVID pandemic, like they are suffering. Okay, suffering from this, and we got lot of like challenges for women and girls with disability. As Pratima and other colleagues have mentioned, they are not getting the basic health services. And as Atif asked, like how many of them get the tested for the corona? I think it's so hard to get the specific data on it because families are not that much interested to take their women with disabilities to the hospitals and get tested. So we really need the mobilized services from the government or the state who are responsible to do that. We should write and come up with a declaration or some kind of petition at this stage because persons with disabilities are still not getting that services. Secondly, I would say women and girls with disability are going through a very like complicated situation of trauma and psychosocial support, which they immediately need, because we have talked with all the women with disabilities from the region, from the Asia Pacific, from national level, and they all mentioned they are actually the witness of the gender-based violence, and they have been sexually harassed because now people are staying back at home, and for them it's not a new situation to staying back at home, but for other people they are staying at home. So now it's the numbers are increased, especially in the rural areas where we have very limited small houses where many people have to stay together, and in that situation this is getting quite complicated for them to survive, and without their personal assistance services, without getting the health services. So how we can provide them the information about the gender-based violence, how we can record that cases, because there is no safe space for them to share these challenges. So in that perspective also, I want to highlight this challenge. But since the COVID response happened, everyone is talking about the challenges and the problems. We have been hearing through different virtual forums and the discussion. I think this is very important to organize another talk where we can see or collect the good practices and see how the government is really responding in some of the countries and what kind of like practical steps we can take to address this issue. And also, I feel like from the state representative, it's important to highlight some of the key guidelines which will be applicable in all the South Asian countries. Yeah, thank you.
Thank you very much, Abiel. The point of women with disabilities rarely discussed because we have attended a lot of meeting in person as well during the COVID. But the point of women with disabilities was not discussed at all. Thank you very much for highlighting. Now we have Ms. Bhargavi Dawar from Transforming Communities for Inclusion in Asia Pacific. She's also from India, from TCI Asia Pacific. Bhargavi, are you there? Yeah. Welcome. So over to you, Bhagavi.
Thank you so much, Atif Bhai, for including me in this conversation. I'm really happy to meet a number of colleagues and people who are working at the national level and across regions from the South Asia, I would say subcontinent. TCI Asia Pacific stands for Transforming Communities for Inclusion of Persons with Psychosocial Disabilities. We work in 21 countries across Asia and Pacific regions. Our major achievement in the last couple of years has been creating an advocacy manifesto called the Bali Declaration. You can find it online. We are mostly seen as health subjects and not having any other identity. Even now, I think so, a major challenge for us has been to, have us viewed as persons with disabilities. This has been one of our key messages to include us, not leave us behind from the cross disability movement. Wherever there is a cross disability issue, it's also our issue. We strongly send out the message that we should be, we should shift the paradigm from mental health to inclusion and open up all the doorways to inclusion, including development entitlements, inclusion in Agenda 2030 in the SDGs, inclusion in all human rights-based services, human rights-based advocacy actions, relating to all kinds of policies that impact on persons with disabilities. So this has been our main advocacy. In terms of disaster responses, and of course we see COVID, the COVID situation as part of disaster as well. In general, we can say that in disaster responses, we are left behind. Human Rights Watch, the international human rights watchdog agency, has brought out in several countries of the Asia Pacific region what is the situation of persons with psychosocial, intellectual, and multiple disabilities within institutions. And particularly this is true for Commonwealth nations and high income countries. But it is true in general across the South Asia, Southeast Asia, and the Pacific regions. When a disaster happens, people are left behind within institutions. This has occurred again and again, for example, in Sri Lanka, India, Philippines, Japan, Indonesia, in many countries of our region. When a disaster happens, people who are in communities can move to higher ground, for example. But in case of people living within institutions, there is no record of what happens to them. And we imagine that they have been abandoned or they have been left there to die by their family members or by the authorities. So, and this is not a single instance, this is quite widespread. And luckily in this time, in the time of COVID, there have been a lot of advocacy efforts by even international agencies saying that whether in prisons or whether in mental institutions or whether in so-called shelters, people who are incarcerated there should be released. In fact, the call for deinstitutionalization has been very strong from different agencies, not just the disability disabled people's organizations, but from across other stakeholders as well, that COVID can actually be a very, very serious hazardous threat to people who are living inside institutions. So the call for deinstitutionalization has come. There is, of course, the context of poverty, homelessness, and no community support systems in most countries of the region. It was really good to see that in Sri Lanka, some of the community support systems for people with psychosocial disabilities or people who acquire psychosocial issues during the COVID period are becoming very, very strong. In fact, COVID has really released the importance of psychosocial health and well-being for our regions and generally worldwide. And people are now thinking mental health. They did not think mental health so much as now. And so I think that this is a mixed blessing, because then what will be the solutions? We are really concerned about that in TCI Asia Pacific, because when you say mental health, then usually people are thinking medication or institution. And in India, for example, we are a Commonwealth nation, just like many other countries of the South Asia region. And when you think mental health, then you think mental illness, and then you think medication, and then you think institution. This is the algorithm that immediately gets into the policy, setup. And before you know it, some 20 new institutions have come up. This is a Commonwealth peculiarity. And so is this the way we really want to go? In Pune, for example, people have started new institutions, not just for people with psychosocial disabilities, but also for the homeless, for people with disabilities and so on. So we're finding a lot more new shelters, so-called, coming up. So there is that. Multiple discrimination. One of our staff who earlier used to be using our services, due to COVID fear, she lives alone in a low-income community in Pune, and was isolated because she lived alone. She had no support systems, and in the lockdown period, a lot of her previous fears, voice hearing experiences, all these resurfaced. When this kind of experience happened to her, triggered off by the COVID lockdown and the self-isolation for long periods of time, the person who owned her house, she was there on a rental, he immediately asked her to vacate the place, and she literally had to run out of the house because of harassment and stigma at multiple levels by the community where she was living. And she had to go missing, literally. She had to go wandering and missing because her support systems, the neighbors were otherwise generally friendly, and she was also our staff. She did not have the time to even call our staff. The harassment was so high that she had to just vanish from that spot, at risk of being, pulled up by the police or put inside an institution. So whatever. So the COVID lockdown has meant a lot of distress, panic, anxiety for people with psychosocial disabilities. And of course, a lot of people have additional fears of poverty and other intersectional factors. Isolation has meant taking away the few support systems that people may have developed, people with psychosocial disabilities. For example,
Thank you very much.
Yeah.
Bhargavi, we will continue in the question answer session. So, we have some other speakers waiting in the queue, so we will continue with this time, 3 to 4 minutes time. Then we can come back on this initial discussions again with question answers. Thank you very much, Bhargavi. Actually, the point on the psychosocial disability was really important. And again, this is an area which is least discussed. So we will come up with lots of questions, and we are having some questions on the live chat as well. So we will share these questions with you. Now, I would request Ms. Marcy Road the chairperson of World Institute on Disability, to share with us the global scenario, like what would be the next, what will happen after the COVID response, or where we see the situation of persons with disabilities. Marcy, over to you, please.
Good morning from Washington, D.C. Sound check. Are we all right?
Marcy, can you hear me?
I can hear you. Can you hear me?
Yes.
Very good. Okay, I think we probably have a bit of a delay. Good morning from Washington, D.C. I want to thank my dear friend Atif and all of you for including the World Institute on Disability in this very important discussion. WID is one of the oldest disability rights organizations in the world, founded and continually led by people with disabilities. I want to talk about three things today. First and foremost, the devastation to people with disabilities in the United States has been well over 20,000 who have died in institutions. And this is only the folks who've been counted. 20,000 people with disabilities in institutions. The vast number of deaths in the US and globally, we're hearing is now 250,000 people. And we know, those of us here together, we know the vast majority of those deaths are, in fact, persons with disabilities. This is a genocide of our people. And sadly, many of us predicted it. We know that the many structural barriers that we face on a daily basis as people with disabilities have been exponentially worse than ever before. I want to note that there has been much humanitarian relief that has started to flow to the larger organizations, and some of those resources have begun to reach some of the larger organizations. But I want to be clear that disabled persons organizations, DPOs, are not receiving, we're not getting access to those resources. This is not unfamiliar to us. Disabled persons organizations very rarely are included in the government and humanitarian relief, and the work that disabled persons organizations can do, not only to support people with disabilities in our own communities, but also as very important leaders, experts, in helping the whole community to be able to navigate this horrific pandemic and other disasters, those that have come before and those that will surely be coming again. We, the World Institute on Disability invites each of you, invites all of our global family to come together and to build capacity within our joint commitment to people with disabilities and to the circumstances that we face over and over again. Later on this week, we will be hosting a global town hall to hear from folks. We want to know what is the experience of local disabled persons organizations, and we want to build in coalition a, mechanism for rapid response for people with disabilities, and especially for disabled persons organizations to be able to lead in our local communities where the impact is both most needed and where we can really optimize outcomes. Um, Following the town hall later on this week, we will be bringing disability leaders and trusted allies together to disrupt the exclusion of DPOs and people with disabilities and accelerate radical inclusion. We invite you all to be a part of this. This is not our initiative as the World Institute on Disability. This is our hand out to our brother and sister organizations so that together we can disrupt exclusion and accelerate radical inclusion. We can't look to governments anymore. Governments are failing us. We can't look to what I often call the humanitarian industrial complex. We ourselves have got to take a leadership seat, and we need to drive the kind of support and the kind of assistance to our local communities that give us a fighting chance, not only to survive, but in fact to lead our communities so that everyone benefits. Thank you very much, Atif.
Thank you very much, Marcy. Thank you. We have lots of questions we received for you on the social media. We will have to share this question later after all the speakers have done. So now I would request Najmul Bari, who's from the Center for Disability in Development and having a vast experience on disability inclusive DRR. He has been part of the drafting of DRR SNDI framework and inclusion of disability in it. We are very happy to have you, Bari, with us. Nazrul Bari, over to you.
Thank you very much. I hope you all can hear me clearly. And it's a pleasure to be among you today, and thank you for inviting me to be one of the panelists. As Atif said, I represent the organization Center for Disability in Development, and we have been working in Bangladesh since 1996 on disability inclusive development. And since Bangladesh is also part of a South Asian country, the different challenges that has been already mentioned, we are no different. So I'm not going to go too much into that. But just like to share, yes, the stoppage of livelihood and income has been a huge problem here, not only for persons with disabilities, their families, the stoppage of different services, the rehab services that persons with disabilities were receiving, the education institutes, there has been reduced food intake. So there's a lot of demand for food supplies and nutrition. Access to medicine is another challenge here with the lockdown. That stop of transportation is very few. And what we have also seen some cases of domestic violence increasing, which has also been mentioned by my fellow speaker as well. And with regard to the relief packages, it's very general food items or hygiene items, but not too much looking into the diversity of disability and the specific needs persons with disabilities will have. Access to information is another challenge here. The disability disaggregated data is there. And what has also been discussed in terms of stress and anxiety, what's going to happen in the future, how are we going to survive, what's going to happen to my family has been another big issue here. And we also need to remember that we are living in countries which is very much prone to disasters. So cyclone is for Bangladesh, and this region is just near the continent. This is that season. We have floods upcoming. So when all of these things will come together, I'm just wondering in terms of evacuation, shelter, the safe distancing, how all of this is going to take place. And then also we need to think of the refugee camps that we have, the very big ones where hygiene is already a problem and challenges there. So many dimension of disability, COVID-19, different hazards are coming all together now. Now, what I would like to also share is some of the good things that has already happened here. I'd like to mention from Bangladesh. Like what we have seen that once this COVID-19 started, there has been greater togetherness of the disability stakeholders, including disabled people's organizations and other organizations working on disability. So they have come together and try to do the advocacy, have the common messaging, which ministries to approach. I'll give you one example. You were talking about the Sendai and our work with the disaster risk reduction. Now, we have been able to approach the Ministry of Disaster Management Relief, and they were already sensitized on the issue of disability. So they were very quick to respond that, yes, we should have a circular, a guiding note sent out to all the district commissioners that you have to include persons with disabilities, do the messaging in an inclusive way, consider the data, all those. The Ministry of Social Welfare, which is the nodal ministry, has also come up with these circular and allocation of resources. There have been different communication materials developed in an inclusive way by DPOs and other organizations. And what we have seen is, persons with disabilities and their organizations, although not in an extensive way, but they're leading in the community. There are some good examples on that. So they're working not only for the persons with disabilities, but the total community, raising awareness, going ahead with the relief packages, mobilizing resources from, their own initiative, from the private sector, from the government, and try to channel all those into the community. And I think that, the more we engage with the different organizations and work together and bring together, we'll be able to reach more persons with disabilities and including them. There has been also some initiatives of having alternative ways, like, okay, could we do some tele therapy or follow-up to the persons with disabilities? And we also have this national COVID response plan, which also talks about the risk information. And the government has specifically mentioned there, you need targeted initiatives to reach the information directly to the persons with disabilities. So if we look into the things that we really need to emphasize and focus on, I would say we really need to be together on this. As Marcy said, DPOs and other stakeholders, disability organizations, we really need to make another big bang and make people hear and listen to the situation and what needs to be done. The inclusion of persons with disabilities is really crucial and critical here. The risk information, which I was saying, the awareness, all of it has to be made inclusive. And we really need to look into the different needs and part the specific disability. Just a few more, like what we have also seen, where there are already mobilized groups of persons with disabilities or self-help groups or DPOs, there the actions towards disability has been much more significant. So we need to look into the future. Once all this is over, like how do we really strengthen the organizations of persons with disabilities? We also think now about what could be the different alternative ways of extending the services to the persons with disabilities. Very soon we are going to have the offices reopen. So DPOs and other disability organizations, we need to inform ourselves and train ourselves, how do we keep our office space safe as per the different guidelines? And, really promote the use of data. And mental health issues have been already mentioned. And, one thing that we all are really waiting for is the vaccination. So we really need to raise our voice now. We are saying that there is a huge lack of testing opportunities for persons with disabilities. The access to the services is there very limited. So we really need to think ahead, how, with regard to the vaccination and including persons with disabilities and engaging organizations of persons with disabilities in this process. So I'd like to
Thank you.
stop here for the moment and maybe
Very,
later.
very interesting and very comprehensive. Now, may I request Annie Hens from Handicap International India, and she is also representing Disability Inclusive DRR Network. Annie, we have been working together for a long time, and it's really good to hear from you. Annie.
Thank you, Atif. Can I just share my screen now? I have a small, short, very short presentation. Can you tell me if it's visible?
No, it's not visible yet.
Okay.
So if you can share it again.
Yes. No?
Yeah, we can see now. Yeah.
Can you see it?
Yes, please go ahead.
Thank you so much. Thank you, Atif. It's a pleasure for me to be here representing Humanity and Inclusion and the Disability Inclusive Disaster Risk Reduction Network. So very briefly about HI, I know most of you know HI, but we are also an international NGO that works with alongside people with disabilities in situation of poverty, exclusion, and disaster contexts. We have a presence in about 60 countries. And with respect to the COVID-19, we've been working on infection prevention and control, inclusive messaging, access to basic needs and essential services for people with disabilities. A little bit about the Disability Inclusive DRR Network. You can see the gang out there with Atif in the middle. So we are a consortium of like-minded disabled people's organizations, some mainstream organizations, disability-focused development and relief organizations. And our collective aim is to secure the active participation and meaningful contribution of people with disabilities, particularly in disaster risk reduction policy and practice. Our main aim is to reduce disproportionate risk of persons with disabilities through ensuring the Sendai implementation of the Sendai framework. So,
any, sorry to interrupt you. The sign language interpretation is not visible because of this presentation.
Okay.
To
I
continue
will.
the sign language. So, sorry.
Okay,
Thank you.
so I'll just
stop presentation and just then it will be helpful.
So I'll probably then stop sharing.
Thank you.
Yeah. Okay. Right. Is that okay? Right. So just to resume, our network is composed of NGOs such as ASB International, CBM, the Pacific Disability Forum, Center for Disability and Development, where Bari just spoke on behalf of that, South Asian Disability Forum, Atif is the representative, and HI. And our geographical coverage includes countries in Asia Pacific region. So we are present in Fiji Islands, Philippines, Indonesia, Myanmar, Bangladesh, Nepal, Pakistan. So in response to the COVID-19 pandemic, what most of DIDRRN members, and Bari has really explained very well of what has been the focus of organizations such as us. So we've been able to pivot our existing DRR programs and experiences for a disability inclusive COVID preparedness and response. So simply speaking, essentially since we already work with DPOs, we work with people with disabilities, we've been working with government authorities and other humanitarian actors in our countries of operation. Plus, we've been working both on policy, plans, and practice, both at national, at local, and at subnational level. It's been possible to adapt our programs to promote better access and participation of people with disabilities. And as international NGOs, we've been able to also share global tools and experiences and adapt these to the country of operation. And at the same time, ensuring that voices of people with disabilities and experiences from the field are able to inform decision-making even at global levels. So very specifically, what organizations like us, we've tried to do is identify these specific risks of people with disability. So what my earlier speakers, Pratima and others, have spoken about is what are the specific barriers faced by, what are the impacts of the COVID-19 on people with disabilities? What are the barriers faced by them? So for instance, in ASB has done a survey in Indonesia, HI has done surveys in Nepal, we've got global surveys. So we've got some information, and Marcy has also given us information about disaggregated data in terms of number of deaths. So there is definitely information, very clear information, that persons with disabilities face significant barriers to protect themselves and their families. The second point of how we've approached this issue is by leveraging or working with existing systems, whether it's government or non-government, to ensure services are reaching people with disabilities, that services are accessible. And what this time has given us is an opportunity to see to what extent our national guidelines and plans, the DRR plans, which are supposed to be disability inclusive, how, to what extent are they being implemented, and do they actually work? And the third important point that I would like to mention is working with DPOs and people with disabilities. And that has also been very clearly mentioned by Bari, who also explained that what we've done is basically, throughout, we've been closely involved in building capacities of DPOs and people with disabilities, even before this. So this has been on disaster risk reduction. This has been at different levels also. So DPOs and people with disabilities are currently mobilized and are actively involved in response activities, coordination, assessments, and thereby contributing to reducing risks and minimizing the negative impacts of COVID-19. So with this short presentation, I will close, and thank you very much for your patient hearing.
Thank you very much, Jenny. As we are running out of time, so I would request directly Mr. Prasanna Kripu, our old friend from Disability Organizations of Joint Front in Sri Lanka. And I'm very happy that all the South Asian countries are presented in this meeting today. So Sri Lanka is the last country to speak. Prasanna ji, where are you? Yes, over to you now. Welcome.
Thank you very much, Dave, for this opportunity to represent Sri Lanka. It's a very good initiative by the STEP Pakistan in the capacity as the DOJ officer designated for international and regional affairs. DOJ is an umbrella organization of 30 member organizations, DPOs and service providers in Sri Lanka, mainly focused on high-level national policy dialogue in all aspects of disability, namely civil, political, social, and economic and cultural rights. I'm also the executive officer of the Commonwealth Disability People's Forum and Sri Lanka representative for Disability International. I'm also the president of Sri Lanka Foundation for the Disabled, Rehab Lanka. Through that, I'm also a council member of South Asian Disability Forum since 2011, I suppose. SLFR is also a very active member of DOJF in Sri Lanka. Its present DOJF president is also one of the board members of the SLFR, the executive committee. If I may touch upon a little bit about the country situation, the Sri Lankan population of persons with disabilities are around 1.8 million persons, and out of that, which is 8.7 of the whole population of Sri Lanka, and out of that disabled population, we have 58% women with disabilities. So it's a huge in the age group of 15 to 60 years, we consider those are the people who can engage in lively activities. There are about 1.1 million people in that category, and 71% of those people are persons with disabilities are not at all economically engaged, or they are not employed in the secured income activities. Most of them are the earners engaged in various livelihood activities on daily wage basis, and this situation created a severe vulnerable situation due to the epidemic, and which has resulted in the lockdown in the whole country. So government of Sri Lanka has been taken a number of measures to prevent COVID-19 spread across the country, such as establishment of the President Task Force. Some of the speakers have touched upon that, and they wanted to control it. It was signed in mid-February. It was a very successful initiative in order to control and mitigate the situation. They have done a commendable job, though there were a few drawbacks whilst dealing with the process. The action taken since the declaration of the restriction started in mid-March, imposing curfew island-wide and lockdown the country, many persons with disabilities were severely affected due to lack of essential food items, access to medicine, sanitary hygiene requirements, etc. Mostly due to the clarity of the government information, because sometimes the urgency required the government to enforce curfew within hours' time. So it has really very troublesome time for persons with disabilities, especially the deaf community, for not having this government information, the clarity, and also not having those information in alternative communications mediums. So the mainstream media is not considered up to the minimum expected standard of giving sign language interpretations. So these are kind of the biggest issues because most of the persons with disabilities cannot really understand what is legal, is illegal, this kind of a situation, especially the dissemination of information was not up to the expected standard. So in Sri Lankan context, the government has this initiative of about 85,000 persons with disabilities out of the whole population have received a monthly allowance of nearly $50 a month. So government has expedited the payment in the month of March, and also they have given the people who were in the waiting list, about nearly 30,000 people who were in the waiting list, also considered for the payment in the month of April. And also in addition to that, later on in the mid-April, government has started to give another 15,000 people who are on top of that. So all in all, there are good 25,000 persons with disabilities were given this rupees 5,000 special economic hardship allowance. So that is one of the good initiatives by the government. Not only for persons with disabilities, the government has given this allowance, monthly allowance in the month of April for nearly 6 million people. Those are the kind of information we received, and the government is going to do it again for the month of May. So the relief given by the government is, though it is not sufficient, but in this kind of lockdown situation, it's a very good support for the people. Unfortunately, the criteria of people who are eligible to get this relief was not properly communicated even to the public, so you can understand the predicament of persons with disabilities, especially the deaf, and also people, the blind people, to understand it in the process. So this has resulted, though the government is putting the country to stay at homes, this situation had created people to reach out of their houses to obtain this relief facility. So that is one of the biggest blunders for not having a policy. Because the very reason is, like one of the speakers mentioned, not having the proper data available with the government. It's like there were no pre-collected segregated data available at the grassroots level to pick who are the eligible people to receive this relief package. But all in all, I must say, the government has established another group of experts how to look at how to reopen the country and recover the economy after when the pandemic situation come to a kind of a control position. So probably within 2-3 weeks time, this committee has to come up with whatever to recover the economy and get involved with these people who are not having jobs, and there have been a lot of layouts at this point of time, especially the day earners, the daily workers who are not in the permanent employment. So their availability, in the sense their existence, is going to be very tough for them. So in this category, there are so many persons with disabilities included, because most of the disabled people are not having that adequate level of education to engage in proper employment. So most of the people with disabilities fall into this category, which is going to be very, very vulnerable in time to come. So that is one of the key areas we have
Thank you,
to address.
personally. Thank you very much. We have listened almost from all the South Asian countries, including now we have very honored. We are very honored to have Mr. Moti Wilcox from UNDRR with us, and we are very much interested to know that how United Nations, especially UNDRR, is including persons with disabilities in their response. Uh, these days, UN is the most active organization response to situation. So inclusion of person with disability is critically important. So Mr. Timothy, over to you. How you are responding, like how the inclusion of person with disabilities will be ensured in COVID response.
Okay, thanks. Thanks, Startif, and congratulations on this summit. It's very much needed. I think we need more webinars like this and discussions and action, I think. In addition to what we've already heard from our esteemed colleagues, I'd just like to highlight a few more points, and then I'll also talk about what we're doing, what the UN is doing, and some recent announcements. I mean, first of all, I think we need to ensure, as we've heard, that, COVID-19 information reaches persons living with a disability and their caregivers. I mean, limited access to information can, leave persons living with a disability very poorly informed about COVID-19 prevention and mitigation and measures. And in many communities and households in rural areas of South Asia lack access to the internet and even TV. So how do they get these messages? In addition, access to relevant information is often a barrier for persons with specific communication needs, and such information should be made readily available in an understandable format and adapted for these people, such as the visually and hearing impaired, as well as semi-illiterate or illiterate people. And we're seeing more attempts by governments to do this, but much more is needed. And we're also seeing very many useful materials prepared at the international level and international organizations, but we're also seeing limited local translations of these, and we need to see more of that. As we heard from a previous speaker, I mean, the indigenous communities may not necessarily speak the predominant language in the country, and we need to make sure that these important documents and guidelines and information are translated for them. I mean, UNDRR ourselves, we had a webinar a few weeks ago also to highlight the needs of COVID-19 at-risk groups, particularly women and persons living with a disability, to encourage partners not to leave anyone behind in their response efforts. And we see this as a key role for us because we sit on a lot of these coordination mechanisms in the UN, where we all sit together and talk about what's being done. And I mean, we hear a lot. There's a lot of advocacy groups for gender and children, and we don't always hear the voices of people advocating for disability. So, UNDR makes sure that we remain strong advocates for this, and we're constantly raising the issues as key priorities among the UN coordination systems, both globally and regionally, and in country where we are, to make sure that these things the priorities are incorporated into the responses that are so much needed. Secondly, I would like to reinforce the earlier message of the collection and use of sex, age, and disability disaggregated data by governments and partners. I mean, this is especially critical at this time to ensure that vulnerable groups receive the targeted response and recovery assistance for COVID-19. Data disaggregation by sex, age, and disability is essential to understand vulnerability and to address these inequalities and build a picture of how multiple disadvantages can also reinforce discrimination and exclusion that's already out there. I mean, for example, we know that persons with a disability, are often the last to receive assistance. We also know that elderly and vulnerable. So if you're an older person living with a disability, then you have like a double whammy, if you will, in terms of being restricting your access to these services, and can also increase poverty rates. Many countries have been struggling to collect such data, and more efforts need to be made to assist them to collect it at the local levels and to use it to inform effective response recovery efforts. Even those that do collect it at the local level, we're finding that the data is not necessarily reaching the people at the national level where the decisions are made. I won't mention the country, but there is one country I know that tells me that they collect all the disability data you could ever want at the local level, but the local authorities are not sharing it with the national government. UNDRR is partnering with UN Women and UNESCAP to try and improve this. particularly training the National Disaster Management Officers and the National Statistics Officers. The NDMOs often lack a lot of ability and resources to collect this data and to understand it. They often don't necessarily have data information people, but the National Statistics Officers focus on that. I mean, that's their job, they're statisticians. So we find that by combining those two, as well as partnering with local NGOs in country and DPOs, etc., then we can probably help to increase this. And this is going to be a key priority for us, I think, over the next couple of years. We really want to make this better to help inform policies in country. Just one last point, second last point, the social protection must be seen by government as an investment and not as an additional cost. Previous disasters and crises have confirmed that social protection is a vital role in reducing the shocks felt by individuals from this pandemic and in preventing the vulnerable from slipping into or further into poverty. As such, COVID-19 social protection and safety net programs need to reach the most vulnerable. We know that studies from WHO and World Bank show that health-related costs already push 100 million people into extreme poverty every year. So all efforts need to be taken to provide free healthcare services for COVID-19 treatment, and that those that need to have access to it. And people with persons with disability already sometimes lack access to the necessary medication. So these social lockdown methods that we have to do is already impacting on that as well. One key piece of work that's just been announced by the UN is a COVID-19 Response and Recovery Fund that's been recently established by the UN Secretary General. It's essentially a funding mechanism for UN agencies to help support low and middle income program countries and respond to the pandemic and its impacts. The fund's assistance specifically targets those most vulnerable to economic hardship and social disruption. And essentially, the UN agencies in country need to make sure that any activities they are applying for funding under this fund are disability inclusive. And, I think one good way that we can help make sure that is done is if partners in country like DPOs and local NGOs, if you have a partner in country that's that's a UN partner, like the UN Women or UNICEF or UNDP, maybe reach out to your partners there and say, hey, look, are you guys going to be putting in funding applications for this response and recovery fund, and is it disability inclusive? The money that they're seeking under this is quite substantial, and I think that's really important. One last point before I take up too much more time is, apart from our advocacy work, we really see a role for us in really, mobilizing partners to help here, particularly donors. And one of these key things is the Asia Pacific Ministerial Conference. It was supposed to be in June, but COVID has postponed it a little bit down the track. But I really feel that it's an opportunity for us to highlight, what's going on here at the moment with COVID. What are the lessons learned? And, there probably will be another pandemic at some point in the future. And I really feel that we can't lose these lessons that are being learned. And, I think that there's a lot of goodwill amongst the donors, and we can use that ministerial conference, I think, to really mobilize some assistance on the ground here. So I'll leave it at that, and I'll take more questions if anyone has any. Thanks very much, Mr. Ati.
Thank you very much, Mr. Timothy. Actually, we have lots of questions, and I was wondering, we are running short of time, so we can't include all the questions right now here. So what we can do, we will share the transcript and the questions with all of the speakers. If there's anything which they can still address, that would be helpful, because we are already, time is very short, so we spared 1.5 hours, so we have to conclude it now, so we can't take questions. But we have the list of all the questions we will share with all of you later, and before finalizing the transcript, we can include the answers of your questions. So now I would request Ms. Aiko Akiyama from UNSCAP. Ms. Aiko, thank you very much for joining us on a very short notice request, and because your participation or your point of view from UNSCAP is literally very important for this situation, especially in Asia Pacific. Thank you very much, Ms. Aiko. Over to you. So I would just request you to conclude this meeting, whatever has been said, from your perspective, how it will be kind of a way forward from your point of view.
Thank you very much, Atif. And then good evening from Bangkok. And then it's so nice to see our friends from all over the world and colleagues from UN system. My name is Aiko Akiyama. I work on disability issues at the United Nations Economic and Social Commission for Asia and Pacific, acronym of which is ESCAP. So yes, I'd like to share my observations hearing all of you of what you have said, and then after that, I would like to share what we as a UN at the global level and the regional level, particularly at the my organization's level, what we are thinking of contributing to this. Yes, I mean, every life is precious, and then everybody has a right, but structural exclusion and then discrimination, which we have anyway for persons with disabilities before Corona or worse in this new normal Corona days. And we even see some very eugenic ideology reflected in some of the treatments of some persons with disabilities, particularly using respirators in the world, which is very disheartening and sad. But this is the moment and time that we, as somebody said, that we really need to unite, because this is the kind of the thing that the all humankind is facing, regardless of the degree of economic and social development in the world. So it's a very bad situation, but it's a time for bringing more solidarity. Now, yes, as many people have said, we have no one left behind, which is the heart of sustainable development goals. We have convention, and then in Asian Pacific, we have Incheon strategy, which is also promoting disability inclusive disaster risk reduction. But none of this will be really good documents unless actions are taken now in this situation where the spirit and the content of this document should be really given life. What I hear from many people from this forum and other people is like, yes, we need to leverage existing mechanisms, and then different ministries and then private sectors and other civil society organizations who are not necessarily usually working on disability issues to work on common challenges and then mobilize resources. Another thing that I hear is like, yes, many countries adapt the convention. They say like, yes, we have information accessibility, but when it comes to the real action, that's not implemented. For example, in a country where I live right now, they publish some what you call that application. They ask people to make applications to help people in general to access to some information on the mobile phone, but none of those applications are accessible, because those who are asked to do this at the government level totally are not aware of those requirements. So it seems to me that at this moment there really needs to be a like mindset at the working level, people who are actually doing things, or at the from the viewpoint of private sector, understanding disability perspectives or inclusive perspectives. So this is where advocacy really works, as Nazmo's example demonstrated. Already existing trust-based relationship, working relationship with the government people or private sector people will be very, very useful. If that doesn't exist, maybe now is the time to really, really foster that relationship, because this is not going to be a short-term thing. This is a long-term thing. And then, yes, the intersectionality of issues such as gender and also internet connectivity in many of the regions, they have a really severe issues of internet connectivity and lack of devices that some of the people here have mentioned, like computers or mobile phones. So this is the really overwhelming issue, and then again, it needs multi-sectoral unity, solidarity, and action. So what do we do as a UN? Now, at the level of ESCAP, I work at the Social Development Division, and we do, first of all, advocacy and reflecting issues and actions that people like you have raised. So we already have the policy brief summarizing issues faced by persons with disabilities, which we distributed to all the government disability focal points as well as other focal points. And we are going to have a webinar on this theme, persons with disabilities and COVID-19 response, inviting a special envoy on accessibility and disability, Ms. Maria Soledad. And as an organization, I'm sure that our colleague from UNDRR is doing the same thing. We are refocusing whatever we are doing to have a definite aspect of COVID-19 response. So if we have a technical cooperation project, we will focus on more on COVID-19. So at the ESCAP level, we might have a technical cooperation project where we will be selecting some countries or areas or the project that people like to have, and then we help them out to really implement the project. Now at the global level, I think pretty soon Secretary General will release his video on his views or our UN views on disability inclusive COVID-19 response. I think 3 days ago, he issued a video and policy brief on older persons and then COVID-19. So the disability version, so to speak, is coming up soon. Some of you might know that the Secretary General of the United Nations launched the UN Disability Inclusion Strategy, acronym of which is UNDIS. UNDIS requests all entities within the United Nations system to integrate disability inclusion. So it's not that only Social Development Division in ESCAP should be doing disability inclusion work. Transportation Division, Disaster Risk Reduction section, or macroeconomics section should be having a disability perspective. So that we need to start to implement this year rigorously. And that UNDIS asks each entity to involve and then consult persons with disabilities. And that is one definite indicator that we are supposed to be reporting to the headquarters next year as well. So I recommend that those of you who are advocating at the national level, and then I'm sure you have some relationship with the UN country team, will also bring up this UNDIS implementation and really trying to mainstream disability or inclusive perspective in whatever the UN country team is doing. And I am currently the chair of interagency support group on the implementation of the Convention on the Rights of Persons with Disabilities, which is sort of like a getting together group of a lot of our UN agencies and entities around the world. So we are thinking of creating a statement of this group, IASG. Okay, there are many, many statements flying around the world, but I wish that you can use that statement as well as SG's policy brief and video to use yet another advocacy tool to implement what we want to do. But in any case, I think we really support what you say and what you want, and then extend our network, and then we are part of your network, and then we always learn from you. Thank you.
Thank you very much, Aiko-san, for your very important point of view. And now I would like to conclude this meeting with a note of thanks to all the representatives from South Asian countries. Unfortunately, we couldn't hear from Maldives due to poor internet connection, which we all understand. And we are thankful to World Institute on Disability for joining us, Marcy, UNISCAP, and UNDR, Mr. Timothy Wilcox. It was a wonderful discussion, and hopefully, like when we will be listening or transcribing this discussion into the report, we will share with you, and lots of points will be very helpful for the future planning. Thank you very much, all of you, for joining us. Bye. Thank you.